Good day. My name is Heather Foley. I am your Regional Clinical Coordinator for the University of Waterloo School of Pharmacy new PharmD program. Thank you for taking the time to watch this presentation. I do apologize that I wasn't able to provide this training to you in person, as I do know it's very beneficial to have the one-on-one. However, I hope that you find this presentation to be informative and helpful. And please take a moment right now, pause this, go grab a pen so you can jot down any notes or questions that you may have for me. Before I get started with the training, on behalf of the University of Waterloo, I wanted to thank you so much for joining our team. We couldn't do it without you, and the students are going to benefit immensely from your investment. In addition, I wanted to notify you that I will be leaving on maternity leave beginning January 10th, 2015. Rob Modestino, a pharmacist from Windsor, will be covering for me, and I will be sending out an email communication with his contact information in the very near future. So please welcome Rob. All right, so over the next 20 to 30 minutes, I'm going to run through a bit of background on the program, give you some insight into the co-op versus patient care rotations and the current curriculum, and then we'll get into what's expected of the students during their PharmD patient care rotations with you. So we'll talk about RX Preceptor, assessment tools, and then a couple of other key components to the program, including interprofessional education and communities of practice. As you may or may not be aware, the University of Waterloo School of Pharmacy is the only co-op program in Canada and only one of two in North America. So students are given the opportunity to go out onto 3 separate 4-month work terms where they're paid employees, and they're basically paid to do technical functions, project work, and to provide direct patient care. And this provides students with a full year of real-world employment experience. And this is before they come to you on their patient care rotation. So when they come to you as a student, these are now clinical rotations. They're unpaid academic courses. So the main difference, in case you've had a co-op student before, is that they are academic courses that aren't paid, so students are expected to provide patient care and to be graded on this, not to be providing project work. As you can see from this table, students spend their entire first year, 12 months, in class doing academic work. In their second year, they're spending 8 months total out on co-op, and their third year, they spend 4 months in co-op, and then they come to see you for their academic rotations in fourth year. Now let's take a look at what the first 3 years of their academic curriculum looks like. When students enter the School of Pharmacy in first year, they're met with fairly simple patients who have fairly straightforward problems. And then as the years progress, their patients and their problems get more complex until they reach year 4 when they are with you, and they're expected to be able to work up a complex patient with complex problems. The therapeutic component of the Waterloo curriculum is based on what's called Integrated Patient Focused Care, or IPFC. Essentially what this model does is teaches the students how to integrate everything they need to know about the patient in order to provide them with the skills and knowledge required to be a practicing pharmacist. So in a typical IPFC week, they focus on core disease states, pathophysiology, physical assessment, medchem, clinical biochem, pharmacokinetics, pharmacology, and therapeutics. And then this is all wrapped up into a mini case that summarizes the topic of the week. Here's a list of all the topics that they've covered starting from year 1 until they see you in year 4. So everything from infectious disease to cardiology, nephrology, to neurology and psychiatry are covered before they come to you in their 4th year. Here's an example of what pharmacotherapy workup would look like from a student based on the IPFC model. Students are taught to look for drug therapy problems based on the IESC model, so looking at indication, efficacy, safety, and compliance and convenience. They are then able to list drug therapy problems that will help them to develop care plans for the patient. Based on their pharmacotherapy workup and their drug therapy problems, the students are then able to develop care plans for the patients, being able to list goals of therapy, list therapeutic alternatives, and implement follow-up and monitoring plans. So that was a very quick overview of the current PharmD curriculum. Now let's move forward to talk about what is expected of the students while they're on their PharmD patient care rotations with you. And we'll start by talking about RX Preceptor, which is the online forum that you will use to evaluate students. So RX Preceptor is the computer software program that's used to complete all the assessments for the students that you have. Good news is it's available online and on any of your mobile devices, so you'll be able to access it from anywhere. And the manual instructional video will be available to you soon. Some other good news is that we've heard University of Toronto is also moving in the direction of using RX Preceptor. So if you are taking students from Toronto and or Waterloo, hopefully in the very near future, we'll only have to be using one interface. The assessments in RX Preceptor are very straightforward. You are not required to write any kind of summary of observations. It's simply checkboxes. So we hope that you find your experience with RX Preceptor to be efficient and very user-friendly. Listed in the table here is an overview of the patient care rotation. So when students are with you, they're with you for 8 weeks, 2 months, and most of their course grade is going to be based on their clinical practice. And you'll see there's 3 assessment points, week 2, week 4, and week 8. Week 2 is informal time to touch base with your student. Week 4 is a midpoint evaluation worth 24% of their mark, and week 8 is where they get their final grade, which is worth 56% of their mark, all totaling 80% of the course grade. So you can see most of their grade for this rotation is based on their clinical practice, which is activities providing direct patient care. The second component you'll see here is interprofessional education, which is worth 10% of the grade, and I'll go into more detail in a couple of slides. Same with the community of practice assignment. And then you'll see professionalism is not graded, but it is still assessed and can be used to fail a student if they act unprofessionally. Please take special note of the following dates listed on this slide, as these are when your assessments are due, your midpoint and final. It's very, very important that these assessments are done on time, as these grades are going to determine if the student can graduate or not. So we'll be sending you a reminder as the dates approach. As I mentioned, 80% of the grade comes from the student's ability to provide direct patient care. So you may be wondering what kind of activities the student would be providing for direct patient care. So we've listed some here, which may include but are not limited to things like med rec, meds checks, bedside rounds, drug information, providing self-care counseling in a community pharmacy, therapeutic drug monitoring, and device counseling. This next section is the most important part of the preceptor training, and that's discussing the care provider assessment and grade norming. In the email that I sent you, I've attached the paper copy of the assessment tool. So it's called the Patient Care Rotations Care Provider Assessment. So if you could please take a moment to pull that up so that we can use this tool to go through the next part of the module. Keep in mind that this paper module is just for training purposes, and you will be doing all of these care assessments through RX Preceptor. So it'll be all online and all just a checkbox. So if you pull out your care provider assessment and you look down the left-hand side, you'll see that there are 15 different competencies that you are going to be grading for the student. So I'd recommend taking a look before you start with your students so that you're able to know what needs to be assessed throughout the 2 months that you're with them. So how do you approach this tool? Here are some pointers. First off, start by determining whether the student performs that competency at a level ready to enter practice. Very important that that benchmark is ready for practice, not that they're at an expert level. So if they're ready to enter practice with that competency, then give them a good, and if not, give them a developing. From there, to determine whether the student should be good, excellent, or superior, determine how consistently the student performs at competency at that quality. If it's consistent, then they would be excellent. If the student consistently and independently performs at competency, then they would receive superior. And finally, with respect to developing versus unsatisfactory, if the student provides incorrect information or performs at a level that would be deemed unsafe for a patient, then unsatisfactory should be assigned. For example, if they have more bad interactions than good interactions. The school has created some small vignettes, which are mock patient student interactions that will allow you to watch a video and assess the student based on how you would assess a student in the workplace, and then we will provide you from the school with the answers of how we feel the student performed. That way you'll have an idea of what we consider to be a standard, and that will help you to ensure that your method and level of grading is consistent with other preceptors across the province. So please stay tuned for those vignettes and the answer keys in an email to follow in the next couple of days. There are a couple other key points when it comes to the assessment. First, comments are only necessary if you've given the student an unsatisfactory developing rating. As well, at midpoint, you're allowed 2 not applicables as far as assessments, but when it comes to the final assessment, all competencies must be assessed. So you're not allowed to have a not applicable. And finally, just a reminder that the student overall assessment is formative only, and it's basically used to assess the student's progress throughout the 3 rotations, and there is no grade assigned for the assessment. They either pass or they fail. As I mentioned earlier, interprofessional education is worth 10% of their final grade. And this really the goal of the interprofessional education is to ensure that your student can function properly in an interprofessional setting. Just as with the patient care rotations, the IPE is assessed through our preceptor, and you're going to be assessing 6 competencies, including communication, patient-centered care, role clarification, team functioning, collaborative leadership, and conflict resolution. The IPE assessment is completed at the midpoint by the preceptor, but for feedback only. The final assessment is completed by the preceptor and an interprofessional evaluator, but the preceptor is asked to enter the assessment into RX preceptor, as we wouldn't ask an interprofessional healthcare provider to have a username and login for RX preceptor. So a copy of the assessment tool will be made in the preceptor package, and 2 not applicables are permitted. For example, your student may not experience conflict resolution or leadership skills during their IP assessment. This is in contrast to their clinical rotation, where they're not allowed any non-applicables on their formal evaluation. So essentially what will happen is a student needs to be exposed to an interprofessional healthcare provider, which could be anything from a physician or a nurse, a dietitian, to someone like a regulated pharmacy technician. So somebody who's not a pharmacist but still a healthcare provider. The student is expected to spend at least an hour with them over the 2 months that they're with you. And this interprofessional healthcare provider will provide feedback on how well the student performed in those 6 competencies. There are no strict guidelines as far as what this interaction looks like, so please be creative. And really the goal is to ensure that the student is comfortable and acts professionally in an interprofessional situation. So as long as you're meeting that goal, there shouldn't be a problem. If you have any questions, please contact Rob or the school to discuss specifics. The other 10% of the student's grade comes from their community of practice assignment. So let's take a couple minutes to discuss this assignment. In case you weren't familiar with the term community of practice, let me go over it with you. Communities of practice can be defined as groups of people who share a concern or a passion for something that they do and learn how to do it better as they interact regularly. It is not per se a prescriptive model of education, but rather a descriptive model of how learning can happen. So how does this play out in patient care rotations, you're wondering? Well, this is the model for our patient care rotations. The large green circle on the screen represents a region, so in our case, Windsor-Essex, or Chatham, Sarnia. The smaller orange circles at the top represent the University of Waterloo School of Pharmacy. The smaller green circles each represent a practice site within the region, although there may be more than 3 practice sites in any given region. The RCC, who is me, is in the orange circle and is a member of the regional community of practice. The regional clinical coordinator has a view of all of the practice sites within the region and can see potential opportunities for collaboration, resource sharing, skill sharing, etc. The people within the practice sites include the patients, the University of Waterloo patient care rotation students, the preceptor, other pharmacists, other healthcare practitioners, and other placement students. For example, a site might have a placement student from another school or a co-op student. The combination of all of these individuals will vary by practice site, but these are the members of the community of practice. The people who are in the white space represent the community members who are not necessarily healthcare providers or patients, but may interact with the practice sites over the course of the placement. This is also a recognition that each of the member of the School of Pharmacy, whether the preceptor, the RCC, the patient, or another healthcare provider, is also a member of the larger community. In the case of this model, the domain is patient care. The community, which if we remember from previous slides includes joint activities, discussions, opportunities for interaction, etc., could exist within a practice site or between practice sites. The region is a community, and the regional coordinators will be able to see opportunities for the community to exist, for practitioners, students, etc., to interact and engage in joint activities as part of a learning community. The practice can involve conversations, stories, tools, or resources that are shared among practitioners and or the student. For example, the student may develop an educational tool about chronic pain management that they can then share with the other pharmacists and healthcare professionals on the site to improve their knowledge and advance their practice. Or another healthcare professional at a site may find a resource on a specific topic that they then share with the student and the preceptor in an informal way. For example, in a passing conversation at a shared meeting. All of these activities, both formal and informal, make up the practice. A practice site can be a community of practice. Practitioners identify and define the community of practice. We want students to seek out learning opportunities after graduation with an understanding of the value of a community of practice. So in summary, what we're hoping for is that the patients, in conjunction with yourself, the preceptor, and potentially with the RCC, can come up with opportunities within your community of practice to make a difference, to provide education, to fill a gap that currently exists, and to add value to your community of practice. So as I mentioned, this assignment is worth 10% of the grade. So keep in mind it's only 10%. So this isn't an assignment that's meant to take away from their patient care experience, but it's meant to add value to their experience in your region. So what we expect is that at the 2-week mark, you've discussed with your student a potential assignment topic, and this is really up to you. There's no strict guidelines. So please be creative and consult with different members of your community to see if there are areas that your student could add value to. Here's an example of the tool that you'll fill out to help you organize your assignment. Just like the clinical rotations and the interprofessional evaluation, the community of practice assignment will be assessed in RX Preceptor, and there are 5 different competencies that will be assessed. So when the student finishes their assignment, it may look like a verbal presentation, or it can be basically materials that are in a written format. The student will present their assignment either verbally or written, and the preceptor, that's you, will evaluate the impact that the student had on the intended audience, whoever that is. This is up to the preceptor and can be in a written evaluation form, verbal evaluations, etc., depending on the audience and what is appropriate. Finally, at the end, the student and the preceptor will debrief about the assignment, and the preceptor will evaluate the student based on the community assignment assessment tool, which is here and the next slide. So here are the other 2 competencies that are to be assessed. And please remember that the emphasis of this assignment is that it will fill a gap in knowledge or practice within the community of practice. It's not meant to be a make-work project. The fourth and final competency to be evaluated is professionalism. As I had mentioned before, professionalism is not worth a grade. However, if the student has repeated patterns of does not meet expectation when it comes to professionalism, they can have academic consequences, and the student can ultimately fail the rotation based on their professionalism. So you will be assessing the student informally at week 2 and then formally through RX Preceptor at week 4 and week 8 at the same time as your clinical evaluations. Just a reminder, any inappropriate behavior should be brought to the student's attention and or the school's attention as soon as absolutely possible so that we can help to mediate and deal with the situation before it escalates. Keeping in mind that the student has already had 12 months of real-world experience as a pharmacy student, we really don't expect problems. However, if the student does receive 2 or more does not meet expectations with regards to professionalism, here's the steps of what you can do to help to mediate the situation. So please contact Rob if there are any issues as soon as possible. Here's a view of what the rubric will look like for assessing professionalism. And just like with the clinical rotations, there is also a vignette for you to practice assessing your professionalism. So I will attach that in the same email. So stay tuned for that, please. And finally, just before we wrap up, a reminder to take a quick look at the Ontario College of Pharmacists legal authority of scope of practice. They have a couple of updated policies regarding expanded scope and also with regards to the supervision of students. So take a look at those links when you have a chance, just to familiarize yourself, especially if you haven't had a student in a while. So in closing, I just wanted to take the opportunity again to thank you so much for joining our team, for being an awesome preceptor for our students, and for taking the time to watch this video. I'm sure you have questions, so please do not hesitate to contact myself, Heather. Even though Rob is covering for me, it may be easier for me to answer your specific questions. So I'm available at all times on my email. If you can get me at Heather Lynn, HeatherLynn .foley, FOLEY, at gmail.com, or on my cell phone, text or call me 226-344-7700. I'd be more than happy to answer any questions that you have regarding this training. So good luck, and we'll see you when I'm back. Take care.